Hi, my name is Nicole Braun, and here is my ID. Okay, the goals of my capstone project are to improve knowledge and skills in administering naloxone for opioid overdose, including proper dosing, safety measures, and resources available for patients that will be discharging our inpatient treatment facility. The second goal is to improve leadership and management skills. And the third goal is to build connections and enhance teamwork by collaborating with an interdisciplinary healthcare team. I work in mental health and addiction, and I have seen overdoses within our facility as well as patients overdose within 2 weeks of being discharged, all of which are preventable deaths. So I wanted to design and implement an education class for patients getting ready to discharge regarding opioid overdose and naloxone. Our facility does not have a class similar to this, and I felt like it would be a great opportunity to assist in preventing overdoses as well as implementing this into our facility. The steps that I took to get this project going is I took the naloxone class. I then met with program director, clinical director, medical director to get permission to start this class once I got all the supplies and information in order. My mentor and I then worked on an outline for the class, such as statistics, when to administer, how to administer naloxone, and such. We then volunteered at Naloxone Utah. Due to us volunteering, they gave us our first set of kits for free, and that's how we were able to get the kits for free, is because we went and volunteered there. The next step we did is I solidified the group day and time with our clinical director. Then we held our first class with our PHP patients. Then my mentor and I created a place in our EMR for the patient to sign accepting the naloxone. This way the kits are tracked and any staff can check to see if the patient attended the class as well as got their naloxone kit on discharge. I felt like this would be a great opportunity to educate, facilitate, design, and coordinate with an interdisciplinary team and also within the community. The benefits to my department, the other departments, recovery ways, and myself of this project is that Recovery Ways will be the first treatment center in Salt Lake area to provide this class and also hand out the naloxone kits on discharge. This connects Recovery Ways and myself to the community. This allowed me to connect with my company on a level I had not before, and I was able to build new connections within the company and the community. And also this allows Recovery Ways, myself, and our patients to be part of the end overdose solution. I selected Cole as my mentor because he's reliable, insightful in NP school, which can help me see things from a larger perspective. He's knowledgeable. He holds his BSN. I work with about 5 other registered nurses. Only about 2 of them hold their BSN, so I didn't have a large selection that met criteria for my mentor. However, the selection I have is very knowledgeable and universal as far as their skills go. All of us have different skills in different areas, which make us a very unique and strong team. The next thing I looked for was that he understands technology and protocols. Cole is an administrator for our EMR, which means he can modify, change, and add forms, which I knew we would need to add once we got the naloxone protocols in place. And he has a passion for learning and helping others. So the purpose of my practicum goals are to improve my knowledge and skills surrounding opioid overdose, naloxone administration, dosing, and guidelines for prescribing, to improve my leadership and management skills, to also engage in collaboration with an interdisciplinary healthcare team, and to enhance teamwork within that team. I want to provide education and resources to the patients prior to discharge. And I also, the purpose of all these goals are for me to build skills, to be a leader, to enhance communication, enhance teamwork, and to also provide a needed service to the patients that I care for, as well as connect with others within the company and the community. So my project took place in a group room at Recovery Ways in Murray, Utah. This education class was presented to our PHP patients, and approximately 15 patients attended, as others were with clinicians in occupational therapy, with their psych provider, things like that. So on average, we had about 15 patients per class. The naloxone class replaced the life skills class for every other Friday at 11 a.m. This was an initial scheduled time and has remained the same for the two classes that we've held so far, as well as it will remain the same moving forward at this point. The issues that were faced were collaborating with many different people, departments, and they all have different schedules. Everyone's busy, everyone works full time. We have a lot of people have kids, school. So it was really difficult trying to connect with all the different people that we needed to connect with to get this class up and running, and all the resources and supplies needed as well. The next challenge that I faced was keeping the patients engaged. A lot of them maybe weren't interested, they just weren't engaged, so that was an issue we faced, but we really just tried to keep them engaged, keep them, talking within the group, asking questions, things like that, so that we were all a part of the class, and that me and my mentor were not the only ones up front talking. The next issue was that I anticipated more feedback from my patients. However, I didn't get the feedback I felt like I would. I just got all positive feedback. So, I just thought I would get more constructive feedback than I did. My mentor and I would meet every Friday morning to assess progress, roadblocks, and what was needed to be completed to ensure that we had all of our timelines established in the beginning. This was really important, as we had to hit all of our timelines to ensure that we had all of our protocols, outlines, and supplies needed to hold our initial class. We also would talk via phone if we had any questions or issues that needed to be resolved immediately. My mentor assisted in collaboration with other teams to set up dates, times for meetings, resources, and permissions to start this project. And he also supported me and volunteered while making naloxone kits. So overall, my mentor and I were very close for this project, and we will remain to be close, as we are the contacts for our company regarding naloxone, and we will continue to hold this course moving forward. So overall, the evaluation, I feel like I achieved all of my goals during this project. I was able to improve knowledge and skills in administering, dosing, safety, and the regulations surrounding naloxone. I was able to understand and learn more about my community needs, which will also create service opportunities for my coworkers and patients. I was able to broaden my knowledge surrounding naloxone and overdose. I collaborated with the interdisciplinary healthcare team, and I was able to improve leadership and management skills by taking the initiative and designing this for Recovery Ways. I built leadership and management skills by doing this project. I also brought together a multidisciplinary team to get this class approved, implemented, and structured that fit our schedule and guidelines for our program. So the benefits of my naloxone project for the company, patients, nurses, clinicians, and other staff were that we created a new education and prevention class for transitioning patients. We were able to provide up-to-date statistics on current overdoses, and we were able to make Recovery Ways the first treatment center in our area to provide naloxone kits to patients on discharge. This also gives our patients another tool to have to support their recovery and to save a life. For my professional growth, this project enabled me to engage with patients on another level. It provided me with a leadership opportunity. It also helped me enhance communication skills. It improved my knowledge on naloxone. It improved my time management skills. I was able to build new connections with the interdisciplinary healthcare team and the community, and I was able to practice communication with other staff and patients. Overall, the naloxone education class has been successful. My mentor and I are in close contact with our CEO and medical director, and we are now teaching this to all Recovery Ways staff and any new staff that gets hired. We are also making it mandatory for nurses to attend the U of U online naloxone course and retaking it every 6 months to stay up to date on current statistics and teaching strategies. We are currently on our second round of naloxone kits, which means we've given out our first 30 kits, and now we are on our second round of 30 kits. We're working closely with Naloxone Utah, which is exciting, so that they can help us keep track of the kits and also provide current information and education to our staff and patients. And we are able to track our kits being given to our patients, as well as track if they've refused the kits on discharge. So this project was stressful, but it was rewarding. It's been successful and opened up new connections with team members I didn't know, along with available community resources. Recovery Ways is excited to have this training happen in their facility before any other inpatient treatment centers implement this. I was able to get another perspective on being a nurse educator by doing this project, and I am able to engage with staff and patients on a deeper level because they stopped me in the halls and asked me about naloxone. So this opens up new channels of communication and a chance to educate them more surrounding naloxone and overdose.